Greetings, my fellow nurse brothers and nurse sisters. Welcome to the Nursing Affiliated channel. I have another important question coming from David Garcia, asking how to take care of patients who are non-compliant drug users, alcoholics, or even individuals that use, while still showing compassion and feeling like your care is not meaningless. How do you do this? That's a good question. So people are going to do what they're going to do, right? You're going to have what's called the non-compliant individuals. You're going to have what's called the revolving door effect, which is the patients that come in and out. ER nurses probably know this better than I do, in critical care or in the, tele floor and message floor, so forth. But in the ER, you're going to get a lot of patients that come in and out. That does not give you a reason to treat them differently. That does not give you a reason to treat them on another level, not give them the care. You give everybody the same amount of care like you're treating them like family members. That's the most important thing. There's no reason to treat someone different for whatever their case, their ethnicity, their background, their culture. No, we have to understand that as patients, when they come in, we have to give them 100% of the care to every person that walks in through those doors. So that said, when you go into this field of nursing, of course, you can't do this, like I always say, for the money. You have to do it for passion and trying to make a difference and a change in people's lives. Others are going to do what they want to do as patients. So all we can do is our best to educate, to reiterate what's going on with the patient and why we're doing this for their care, and also make sure that they verbalize back what you taught them or what you educated or what you told them. It's very important to do those steps. Sometimes with different patients coming in, we don't know what's going on. They have different aspects of their lives going on that's completely different from our daily lives. But when a patient does come in, we're offering them everything we can to make their diagnosis and implement a care plan for if it's chronic pain, if it's issues with, COPD, asthma, pulmonary, or cardiac issues. Whatever it is, we put them first before us. And if they come in again 2 days later after we educated them, yeah, we may be a little irritated, but we're still going to give them the same care you give everyone through those doors. So to answer your question, brother, when everyone comes in, you treat them the same. Don't treat anybody differently. We get those patients that come in and out. They look familiar, but again, that's the most important thing as what we do as nurses. And you will not get burnt out because there's a lot of issues that happen besides the same patients coming in. What we did and what we can do is continue to do our best, give it our all, continue to educate, and put your best foot forward. The last one, I'll end it on this note, guys. The patients are going to do what they're going to want to do. You open the door, they're going to have to walk right through it. Anyways, hopefully that answered your question, my friend. That's a great one. If you guys have any more questions, put them on the bottom in the description. Don't forget to follow, like, subscribe, all that good stuff, my fellow nurse brothers and nurse sisters. And I will talk to you guys soon. Peace.